So there are 1 billion people who will never see a doctor in their lives. They live extremely far from the nearest hospital, and care is pretty hard to come by. There's a lot of distance between houses, huge amount of distance between the communities and the health facilities. And so what you have is a community health worker that is responsible for somewhere between 20 and 100 households that she is caring for and visiting. Each household can have, say on average, 5 people, but could be up to 8 people average, some of the places that we work. And so if you think about how many people out of that 500 might be pregnant, how many children under 5 might be the right age that they should be receiving vaccinations in the first 2 years, or vitamin A supplementation for the first 5 years. It's a lot of people that are in need of care at any given time, and keeping track of exactly where everybody is in their pregnancy or since they received their last vaccination is essentially, it's really hard. So it's within that community health system and infrastructure that Medic Mobile works. We build tools to support those health workers and try to make the job that they're doing to care for their neighbors a bit easier. It can look like a bunch of different things, but for the most part we build software that the health workers can use to register patients and then receive messages about when they should visit them and what kind of care they can provide. So we have some really cool systems that work on basic feature phones using SMS, and health workers can register patients and receive text messages back, for example, when it's time for a pregnant woman to go to the clinic to receive an antenatal care appointment, or when it's getting close to her time of delivery, the health worker will receive messages telling her to visit the woman and coaching her about creating a birth plan and visiting the hospital for the delivery. Do a similar thing for childhood immunization planning and coordination. And then more and more, as smartphones are becoming more prevalent, it's becoming easier to charge them and even safer to have them in communities. We're starting to build systems on smartphones as well, which are really cool and really powerful and open up whole new windows into how we can support health workers, not just to coordinate appointments that are happening at the health facilities, but actually provide care at the doorstep. So diagnosing cases of malaria, diarrhea, pneumonia, and actually being able to treat them on site, or know when it's serious enough that they need to refer. Try to build kind of you might say a decision support system to help the community health workers kind of guide them through these protocols that exist for doorstep care. There's really a lot of positive energy in this space now, and I think there's been a ton of pilots done all over the world that show the value that mobile tools can bring to supporting health workers. And so what we're trying to do now is show that we can maintain that kind of energy and those kind of outcomes as programs really scale. We try to look forward into the next 10 years of community health and think about what community health worker systems are going to look like in the next 10 years and try to design for that in the tools. So for example, a lot of community health worker programs are becoming a bit less siloed now. Community health workers are being empowered to provide even more care for more different types of diseases and things that they see in the communities. So rather than simply being kind of detection and referral to the facilities, more health workers are being able to actually provide basic treatments in the communities. Instead of being case-based in the way we think about our data infrastructure, it's important to actually be person-based. And so what that means is that instead of registering a pregnancy, we register a person that happens to be pregnant. And then if she gets pregnant again, you can register another pregnancy, but you still see her previous pregnancy. And if she gets sick in between, we have that history as well. So rather than tracking individual cases of things that might happen, we're thinking about caring for the person over time. And that's something that is a change happening in community health systems that we're trying to mirror with the technology.